top flight. So if you have any questions that you want to direct to her, I'd like to encourage you to ask her directly at this time, because she may have to leave a little short to make her flight all the way back to Dallas and then back to Houston. Understand that we're having the same problem, man. It's a male thing, I guess. But so thank you, Dr. Lozano, for joining with us. Thank you all. At this point, if you have any questions, if you'll kindly raise your hand, I'll see if Mark or Jenny or myself can hand you the other mic, and we'll see about getting that question answered. So don't be shy. Raise your hand. Where are we at? We're way over here. Okay. Thank you. Wait until I got all the way on this side. I'm going to put in my 20,000 steps today.
This is for Dr. Gonzalez. Has there been any research with women that have dementia or Alzheimer's and hormone replacement therapy?
Okay. I'm not familiar with the specific research off the top of my head, to be completely honest, but both of you were shaking your heads. So.
I can't speak about hormone replacement therapy in particular, but women are at the epicenter of the Alzheimer's crisis. Women are more likely than men to develop Alzheimer's, and then women are also more likely to be caregivers. So for a while, the thinking was that women live longer than men on average, and so by virtue of them living longer, there are more incidents. But they're actually thinking now that there may be something to estrogen and the changes, hormonal differences between men and women, and as contributing to the disease. But the exact mechanisms of it, I don't know. I'm not sure if they are known, but they're working on it.
So in regards to hormone replacement therapy, I think the current answer, as for most things, unfortunately, in Alzheimer's disease research, is that it's complicated. So there was a lot of excitement for the Women's Health Initiative of 10,000 women, and they followed them over time. They were hoping to see lower rates on hormone replacement therapy. They did not. And the findings across studies have been mixed. When we look at the animal studies, what the research shows is that there's a kind of more of a critical period that if you use, and again, this is animal studies, not people, it hasn't been shown as much, but if you start early and maintain on that, that's associated with the best outcomes. So the current hypothesis, the model that they're working on, is that there might need to be a critical window of maintaining on hormone replacement therapy kind of continuously, not waiting until late. But again, the research is quite mixed, and unfortunately, the research is lagging behind, so there's going to be more studies on this that are desperately needed, but that's a great question.
All right, thank you so much for those answers. Do we have anybody else who may have a question? Well, go ahead, by all means. I mean, we've got them here. Let's utilize them.
So whatever diet and whatnot. My mother has dementia, Alzheimer's. I think she's mixed, but anyway, what I have noticed, she's always been very healthy. She's always been very active. But one thing I have always seen in her diet, she ate very well. She's not obese. She's never been obese. She loves ice cream. And she's always loved ice cream. So when I brought that up to her doctors, I mean, I guess now it's too late. But I asked them, I said, could this have been a contributing factor? We know that sugar causes inflammation in the body. And they were like, no, then just let her eat all the ice cream she wants. I don't know. Any speak to that?
So there are a couple of things there. One is, as we get older, too, people tend to want more sweets, and that might be because of changes in our taste receptors. So because of those changes, we may get more drawn to things that are sweet to make up for some of those changes in how food tastes. But with regard to cause, again, a lot of the research that I reviewed is about risk and probability. The sad thing is that it's not a one-to-one relationship. And while remember that the line diet sweet was just one recommendation out of 15 for some people. And so that in and of itself being a cause, I would say is not likely, but if that's combined with other poor dietary choices, then that's really where we start seeing the biggest changes in risk. It's not any one thing, it's a combination.
I'd like to add something. I think it's important to keep in mind what Dr. Gonzalez mentioned, and that's the fact that it's not just one thing. And probably between the four of us, I might be a little bit older, which doesn't mean I'm wiser, but it just means that I have a stronger opinion. But I think if I remember, just in my family in particular, I remember a great-grandmother who lived next door to us. My grandmother took care of her, and she kind of kept her in this back room, and they said she was just upset because her husband had died. What it turned out to be later was that she had dementia. And so when I think of it just in my lifetime, having that experience, the fact that women are very underrepresented in a lot of studies, which we all know, I think we're starting to see some of that change later. I mean, we're seeing that now, but it's still not significant enough, I guess, to be able to just, we're never going to pinpoint one thing. There's always going to be several options. There's going to be several things to look at. There's things you can do to try to make things better for your own life. However, there are some other factors that are inclusive in that as well. I mean, there's even some studies out there now that talk about the mental health issues, the chronic stress that Dr. Gonzalez mentioned as well. Chronic stress is something that's often found a lot in women as they progress through life, kind of unintended consequences of not dealing with situations that occur early in their life. So I think that, just to kind of keep that in mind, you're not going to stop one thing and then all of a sudden you're not going to get the disease. So just wanted to throw that out there.
And also just to add, maybe to build on what Dr. Gonzalez was talking about with behaviors. As the disease progresses, it can be tempting, and I'm not saying you're doing this, just in general, it can be tempting to want to know better and do better and control the things that can be controlled in a disease that can often feel chaotic. And so, in theory, ice cream is bad, or ice cream's not the healthiest choice, and so you want to make the healthiest choice. But that has to be balanced against the sort of moral stance of being present to your loved one and finding moments of joy and creating moments of success and opportunity. It's not an easy balance to strike. I have seen palliative care docs that sometimes prescribe cookies or prescribe something because they'll know that it will bring a moment of joy. So it's just something to think about as you're reflecting in the world of picking the battles that you want to pick. And if you can, use something to leverage then to sort of build that relationship then to get the harder activity accomplished, then, sometimes you pick the lesser of two evils.
So with that, I'd like to segue into something that you discussed earlier, the Framingham study in Boston, okay? So my question is, you talk about the exercise and doing that. I'm already 60 years old. Should I have started this 40 years ago? Or can I start tomorrow and I'll be okay? So, what do you think?
It's never too late. We see cognitive plasticity and changes throughout the lifespan. In fact, one of the exercise meta-analyses that I put up there show that even in people who already have significant cognitive impairment, by including regular physical activity, we can see measurable, significant improvements in some thinking abilities and really in quality of life and general health. So even though it's good to maintain this throughout the lifespan, it's also never too late to start.
Well, that's good news, because to be honest with you, when you put up the, when you guys were using the charts and everything, I'm like, okay, I've got high blood pressure, there's diabetes in my family, I'm Hispanic, so it's like I've got even more risk factors added to that, so because of that, all those, so that's like, and according to my height, I'm also obese. According to the BM, body mass, what do they call it? Yeah, right, so that's 3 or 4 already, so God, that's scary. But yeah, do I still go to Whataburger? Yes. Have I started the Mediterranean diet? No. And even though I know these things, but that's also, I guess why I bring it up too is because I think that's common with a lot of us, is that we know what we're supposed to do, but for whatever reason we don't do it.
So, again, a lot of those facts can be very sobering to look at. They can be very anxiety-producing. I like how the way that you're able to present that in a way that can we focus on the things that are positive, the things that we have control over, and really refocusing on that, what there is control over, and then also doing baby steps. Because again, we're working against a lifetime of different behaviors, a lifetime of different routines that we've fallen into, and starting off small. Because really, these changes are most important when they're changes in your lifestyle, when they're consistent changes. So again, start off small, baby steps, have a strong foundation, and then build from there. That's really the key.
As someone who is not particularly athletic by nature, there's a reason I went to school for a long time and didn't join the football team, because I am not naturally gifted at that. I had a little bit of an understanding that it had to be hard, you know, but taking those baby steps, find something that you enjoy and build on those successes that way. So for me, I enjoy dancing, so Zumba is a good fit for me. For somebody else, Zumba may not be a good fit. Maybe they want to do water aerobics. And, you know, maybe it's really hard to give up all the beef, because we live in Texas. But if you can maybe cut in some lean turkey into your ground beef. You know, these are steps, these are the small, attainable things that you can do so that it doesn't feel like, oh, well, I have all these things against me. So I think Dr. Gonzalez's point about making small, attainable, realistic steps, you know, you don't have to go run the Boston Marathon tomorrow, but you can walk to the mailbox and back. You know, these are small things, and then you build on them little by little.
And I think the other thing to consider too is the mental health component to all of this. The emotional attachment, especially that our culture has to food. Our emotional attachment comes from being around family, and whenever you're around family, for any particular reason in our culture, there's food. There's a lot of it, and a lot of bad food. And so, but bad food is what keeps us happy, some people think. It's somehow we've connected ourselves to that. So there's also something that's not discussed when we talk about lifestyle, and that has to do with the mental health part of it. The emotional attachment, depression, feeding anxiety, all of those kind of things too that have to be addressed. Which is another thing in Hispanic culture, in a lot of cultures that people don't even talk about. They don't talk about anxiety, they don't even recognize it, they don't even know what's going on, they don't even know that it's part of it. And then I think the other part is too, which is one of the things that's true for me, is just a dysfunction from just really having needing the knee replacement. And so just having a bad knee and not being able to really move around and do these kind of things. And so it just kind of catches up with you. So I think it's also very important to recognize about, I don't know, probably 25 years ago I quit smoking. I was a daily smoker and I just thought I've got to quit. I just hated it. and I just couldn't do it. I thought I couldn't do it. So here's what happened. I read this article in a blog that said, it's the 5-minute rule. Some of you may have heard of it. It was really simple, and it was when you're thinking about it, wait 5 minutes to have the cigarette. In those 5 minutes, do something that you really enjoy. It could have been anything. I like playing video games, reading a book, going outside, working on the garden. You'll forget that you even thought that because you have so many thoughts that go through your mind at one time. So you can kind of do the same thing with food in the kind of that regard as well. Find something else to do. Think about why you're grabbing that. Think about, the changes you can make. I mean, that food brings you comfort. I think that's something we can't ignore. So I think that's also something you have to think about, what's going on in your head at that particular time.
Thank you. Dr. Kutac, big round of applause for Dr. Kutac. She's got to leave, she's got to make her slide. She's got her ride ready, but we can talk about her when she leaves. Thank you so much for everything. We really appreciate you being here. Thank you so much. All right, guys, we are going to continue our question and answer session. I do believe we have a question over here. Was it directed to Ms. Kutac? Well,
No, it was actually, it's a comment, but I'm glad I'm saying it for you. Your talk was really wonderful, because I love that it really, of course, I admire and appreciate the other talks, the research and the doctors, but you positioning yourself as a lay person / educator with a lot of this knowledge is where I think a lot of us are wanting to get. So really appreciated your talk. I have a question. It's another one. I know we all keep coming to you because I get this question a lot about the things that cause it. And one of the real important things I learned in your talks, Doctors Gonzalez, is that research is, you need a real large study in it, and even then, it's how many studies and all of that. So that just emphasizes, I guess, that we need so much attention on research and the research dollars for that. So some of us that are behind that have got the mission. But this is kind of bringing it back down to the real level again, kind of like Patty's questions. I have a very intimate connection to someone who's 93 years old, and he's an extraordinary physical specimen when he golfs still and he does all that stuff. And one of the things I used to always joke about is I'd say, okay, everyone tell me what he eats, and tell me what he does. And one of the things that he does, and my mom does it too because they're partners, is takes a lot of vitamins. So I kind of want your take on supplements, just your opinion on it, I guess. And then the other thing is that man eats the hottest chiles every single day. Every day. And it's not like normal chile, it's the unbelievable. And he eats it almost with every meal now, but definitely every day, but almost every meal. So I'm just interested in your take on supplements, whether there is anything that we should be at least thinking about, should be in our diets, as a part of our life, and then what about the chile thing? Really, what about the chile? Good question.
So I'll start with the supplement question. Supplement question it's a good one. So one thing to keep in mind is that supplements unfortunately are not FDA approved, so you do kind of have to be careful about what you're getting. What we know is that there's certain vitamin deficiencies that are certainly linked to cognitive decline. So the B vitamins, those are very important. Thiamine, B1, those vitamins we know can be linked to actually some reversible cognitive decline. And so I say multivitamin, it's good, it's not going to hurt you. If someone's showing signs of cognitive impairment, any good doctor should get their blood checked to look for vitamin deficiencies for reversible causes. So that's something to definitely keep in mind to do. So I don't recommend taking a huge handful of them, but a small multivitamin is good. And then getting your blood checked regularly too, and seeing if there are any deficiencies that need to be remediated.
Yeah, I would just echo that comment. With regard to the Chile, I've not seen anything about, I don't know, Laredo, I've not seen anything specific about Chiles, but an interesting link is that there are some anti-inflammatory diets which are being promoted for cancers in particular right now that have positive effects. And one of the mechanisms, possible mechanisms for these plaques is chronic inflammation over time. So it's a possibility, it's an avenue for research, but I've not seen anything conclusive on it.
Well, and maybe if I could just add that, well, I think people can hear me, but I'll take it. If I could just add that part of what I also learned today, which I was coming to the table very curious about, was the hereditary impact, and how worrisome should that be for those of us who have Alzheimer's all wrapped around everything. And this same physical specimen that I'm referring to whom I refer, he has one son, one boy, and 3 older sisters. He's the youngest, and the 3 older sisters, 2 of them have already died from Alzheimer's, and another one has Alzheimer's today. So that was another reason why, you know, it really caught our interest, and certainly caught mine when I got involved in Alzheimer's. So it's interesting to note that it's not necessarily a guaranteed result if it's in your hereditary line. Thank you.
And I'll just add too, so there's always this interest. We always want to study these people that are like 95 years old and they're great and they're out and they're playing golf, and we want to know their secret. So there is some great research being done on this. There are super ager studies of individuals that are 70 plus years old that have memories as good as most 50-year-olds their age, and they're studying them. And there's also a lot of interest in studying the mechanisms. There's thought that there might be differences in how these people are able to clear out the bad proteins in the brain, the amyloid beta. So that's a really active area of research to try to study these people to figure out, are they more efficient at clearing out these proteins? What is kind of the biological mechanism of some of these secrets of aging? So that's an exciting and important area of research as well.
I think there's just still so much that we don't particularly know, and I think that we're still just, you know, kind of trying to, you know, every time we throw the ball at the basket, we're trying to make that basket. And I think we have made some strides, a lot more than when my great-grandmother was, you know, locked in the back bedroom of the house. I mean, I think that, you know, I think we have made strides, and we have to keep thinking about that. But I have heard of the Chile thing in regards to the anti-inflammatory, that there's been some significant, there's some significant progress in kind of looking at that factor as well. How he can handle it gastrointestinally is what amazes me. I mean, I just can't imagine that his stomach is still taking that on, and that's just amazing.
All right, once again, thank you. Do you have any other questions?
You mentioned anti-inflammatory supplements. Is there any of them that you highly recommend? Name brand, or?
So not a name brand, it sounds like there have been anti-inflammatory diets that have been recommended. So her turmeric is one, including Chile. But I actually am not familiar, because that anti-inflammatory diet has been created for cancer in particular, for helping reduce risk for cancers, where I've seen a lot of the research. And you all add anything to that?
Okay. Don't be shy. I know there's tons of questions. I know you younger people out here are thinking,
What about
well,
caregiver questions? I mean, that's kind of my focus is to be on family and caregiving, and I'm sure they all of us can speak to those issues. I know some of you have like a whole list of those questions.
Okay. My question is, my mom is 94. Okay, I've already been through all the stage of everything, but I still have a problem with money that she put away. Will she ever remember where she put it? Am I gonna find it after her clean the house? Because my mom had an issue of putting it inside a sock and hiding it in between the mattress. And she would just, now all the money is gone. I would give her money and she never had it. So I hope I'm gonna find it when she passes. But I have brothers and sisters who are also gonna be looking for stuff. And even though I'm not what do you call it? A sane person, power of attorney person. But I'm the one who's mostly there, I'm more the caregiver. But I have a funny feeling, once my mom passes, I feel like my sister's the one power of attorney, beat me to this, so. And my question is my mother, if I ask her, how do I ask her? How can I bring it back, her memory to kick in? Like I tried the other day, Mom, how do you make deviled eggs? I told her, because she used to do that when she was young, when she cooked for her, or she made mole, whatever. Because I go, hopefully she'll remember, because I can't get anything out of her. She just says my name, that's all she says. I'm there, and she'll, ma'am, I'll come here, but it doesn't happen, so I said, okay. But my issue, I feel that the money situation is still hidden somewhere. I don't know where. I'm not going to find it. We're all going to memo cells.
No, you're not going to find it, at least with her giving you the information, I can tell you that, unless, she kind of accidentally finds it. So it's a common issue among people with dementia, Alzheimer's, to kind of hide the money. They're not thinking, I'm going to hide this money so no one will take it. It's just there's a lot of different reasons they could be doing it. One is they know it's money, they need to do something with it. Two, the generation in which they were raised, which she's 93, obviously they grew up at a time when they put money in socks, or they put it in a can in the pantry. I mean, you can start to look at those places yourself. You ask a really difficult question. I mean, if you just came out and asked her, she can have a moment in which that part of her long-term memory is triggered, in which she'll come out and say, here's where all the money is, but I guarantee you it's not just in one place. I just recently talked to caregivers, actually just 2 weeks ago, when his father died, they found $20,000 in separate locations in the house, a total of $20,000. And it was, one was in an old heater in the bathroom that was no longer working, and I don't know what caused them to pull that out. I think they were looking for that money myself.
That's what I'm thinking. I know my mom pulled out a loan when my dad passed. My mom goes, okay, I can handle it. I'm going to refinance the house, pull out $80,000 and use the house as collateral. Well, the only benefit of that doing was that she didn't own the house anymore, so she was able to get the other services that she got eligibility for it. But that $80,000 is still, there's no way she could have spent it all. There's no way. So how much money we need somewhere in that house? Or the caregiver or the sitter who took care of her took it or whatever. But there's a lot of possibilities. But I don't understand that she can. And then another question I got, the baby situation. My mom had a tendency to put her fingers in her mouth all the time, and she's like choking herself all the time. So I have to remove the hand from her mouth. I guess she wants to suck on something, but I don't want to go pacifier situation. I know they go back to baby things, but I thought maybe like something to cuddle, a baby or a stuffed animal or something that will.
Yeah, that tactile sensation is really important. So when you lose language, you just want things that are very comforting, and also, when the hands are idle, it can cause, trouble, cause people to pick at themselves or touch things too much, leading to infection. So it is really good. Everybody's a little bit different, but oftentimes things that are very soft work well. Things that are tactilely interesting, that have a nice touch to them, just keeps the hands involved and engaged. I worked with someone, and he was he would get, when we wheel him out in his wheelchair, he'd try to grab onto people. So we got him a ball so that he has something he could squeeze and hold on to. So those are great ideas to have something like that.
I have two questions. One of them, my mother, for the last, couple of months has been becoming more and more agitated about people's clothes. And now it's getting to be the housekeepers slash caregivers. She wants them to take off her clothes. And so we've been able to redirect her, but it's getting, harder and harder. And as you were, Mitzi, as you were giving your talk, and I was trying to think of activators, what's causing this? I just can't come up with a reason why she thinks that everybody's clothes belong to her. And so, the caregivers are like, what do we do? And so I'll send them back and say, okay, put a different top on. And they'll do that, and she'll come back, no, that's mine. And she wants them to take off their clothes because they belong to her. And I'm at a loss. I don't know what to do anymore. And then when I take her out, not in public, she will go approach somebody and grab their jewelry or their earrings and say, these are mine. And everybody's pretty nice about it, and they'll say, yeah, but you gave them to me. And then she'll go, oh yeah, I remember. And she'll walk away. It's good, but now even that is, she's not believing that anymore. So I don't know what to do.
What were they wearing?
It doesn't matter. They can have their uniforms on. Most of the time they're in uniforms.
They're in scrubs?
They're in scrubs.
Are they wearing a white lab coat?
No. And they're colored scrubs, that have a print on them. And
Yeah, I've seen that several times, and this is the recommendation that again, everyone is different, so take it as only suggestion.
I've seen them wear, I've usually recommended that the caregiver wear a lab coat. And the reason is because older patients have a tendency to be respectful of a lab coat because they think it's a physician or a nurse. And so if they wear a lab coat, they're not going to approach, they may not say anything, they may just be quiet about it. So, that's one thing. And the other thing is that if the redirection isn't working, there's something about those individuals that are making her anxious. Because if they're wearing regular clothes, it could be that she's trying to tell them that they're not wearing the right clothes for being in her house and being there helping her. I'm just going, In my experiences in working in the geriatric psych unit with those kind of patients, you usually have to kind of figure out what is she really trying to tell us here of what might be particularly going on. And if she's attracted to the jewelry, what I did for my mother is I got her a shoebox filled with just plastic jewelry. And she entertained herself with that forever. She would also tell me that the jewelry I was wearing was hers. So I gave her all this jewelry. She still used to say, well, I think yours is more than mine. And I'd say, no, look how many you have. She had like a bunch of plastic jewelry. So she entertained herself with that, and that seemed to work. You have to give her something to entertain herself, and I think the tactile response also is reflective of that intervention. So you might want to try that. Something to redirect her where she can actually touch it and see it that's not that person in front of her. Just some suggestions.
My second question is, shortly after she was diagnosed with dementia, she fell and suffered a traumatic brain injury. So then it got worse, of course. It's much worse. So after she suffered a traumatic brain injury, she lost her ability to sit and watch TV. She can't comprehend television, she can't read, she can't write, her language is not very good. So we have a hard time entertaining her or getting her, And so what she likes to do is she likes to go outside and she picks up every little brown leaf she sees in the yard. That's all she can do, basically. And so cognitive stimulation's been very hard. We tried games, we tried puzzles, we tried, computer things. It's just difficult. If we take her out, so she does go to exercise class twice a week. I take her to exercise class. We go to the HEB. We do that kind of thing. It's getting more and more difficult because she's disrupting the rest of the ladies in the exercise class because they have her clothes on. And, or at the HEB, everybody has her clothes on at the HEB as well. So my question is, would she be better off in a home where there's, facility where there's structured activities, I'm at a loss as what to do now at the house.
Yeah, I think that, comes down to a personal decision. It's complicated and you have to weigh a lot of different factors, but oftentimes it is really good. I think that family members feel a lot of guilt about placing someone somewhere, but it is really good for your loved ones to be surrounded by people and engaged in activities. An intermediate step is also adult day health programs. So, they usually offer from 8 to 5 some services, daytime, come back home in the evening time. That's kind of another option too. And a lot of the patients, particularly when we see younger people with dementia especially, because they're young and they still have a lot of energy but they can't do as much, it's great to have some structure and some activity.
I also want to add that at some point, and I'll talk about this a little bit in my talk, but at some point there's a decision to be made. Do I want to spend the rest of my mother or person I'm caring for time with them as their caregiver or as their wife or their husband or their daughter or their son? If you want to spend time with her as a daughter, then letting someone else take on the caregiving is a very important decision for you emotionally. It is a very personal decision, but it's a much different role to be a caregiver, even if you're the daughter. Somehow you can figure out a way to change that. If you can't have somebody there 24/7, where you come in as the daughter or the spouse. But a lot of people feel that obligation because they are the spouse, or they are the partner, or they are the daughter. But at some point, and I heard this a long time ago, Dr. Royal talked about this in San Antonio, but in a 24-hour period, it takes the ideal number of people to have to care for someone with Alzheimer's is 7. 7 in a 24-hour period. So you can go ahead and do the math, but I guarantee you, very few people have 7 people. But when you can place them in a facility, then you can have those 7 people. Hopefully, there's 7 people in 3 shifts or 2 major shifts. So something to think about. It's a difficult decision, but remember, the people that you're going to send them to are professionals. They work with those individuals. They know what to do. Do they love them as much as you love her? No. But they are professional caregivers. And sometimes because we do love them that much, that decision is the best decision for them.
Can I just ask a question about the caregiving situation, since you asked for one? I have somebody that I'm helping. I'm helping his family care for him and guide them best I can. And he does not have Alzheimer's, and he probably has dementia, but he is difficult. And he is at home, and his family wants to keep him at home. So fortunately, he had long-term health insurance, and he was paying for it 25 years and paid a lot of money for it. And then he started getting much more difficult and confused and was ready to cancel it. And that's when they called me to have me come in and keep him from doing so, and then be the bridge to get the coverage in place. So we do have professional caregivers coming in for most of the day. Here's my dilemma about it, is because when I'm now called upon to answer the he said, she said situations with the caregiver, where the caregiver is telling me he's hitting me, or he's screaming at me, or he's calling me names, and then of course he's telling me I absolutely am not doing that, that's a lie, they're lying to me. He's already now even moved into the stage where he's saying they're stealing from me, and so I've pulled all of those variables out of there between me and his relatives that live out of Laredo, so that's why they're for me. How did and since I have somebody here from Bright Star, how do the caregivers, how would they feel about a nanny camp? How would they feel about that? Because several people, and including his family, have asked me, well, why don't we just install wireless and put the cameras there in there. I mean, I have no idea how that would leave you.
Are you talking about
Professional caregivers?
Yes, it's a caregiving outfit. It's Champion Care. It's a caregiving outfit that comes in and it's in his home.
Well, maybe Bright Star can speak to that, but if we do it for children, I don't know why we can't do it with anybody in the family. And they're called granny cams, by the way.
Okay.
And people are using them more and more.
Okay.
So, but you can, Bright Star maybe could speak to that.
How would you feel about it, Bright Star representatives? Would you feel that it feels, there's something about it that doesn't feel good, or that feels doubtful or accusatory? And do any of your clients that you service do that?
What we've been told is that we want to dress with our own clothes, not identify ourselves using a uniform. We want them to think and know that we are part of their family. So therefore, there's a more connection there versus us walking in with uniforms.
But how would you feel if we had cameras installed there in their house?
I wouldn't have
It wouldn't be a worry, or wouldn't feel
if I'm doing what
intrusive?
I'm there to do, there's nothing I can hide.
Okay.
So if I'm saying this is what I said, and there's a camera, that's what I said.
Okay.
So even before the camera, it would take the family to trust anybody that walks into that house, and being so that they're going through so many different changes with their brain, it would help for you guys to know, to ease you what's really actually happening, and for you to know that what I said is what is going, and therefore not to show the patient, no, look, I already have this here, she didn't say that, you said it. It's not for that, it's just to ease the family, that what we're doing, what we're there to do, is what we're doing as care professionals.
Okay. Thank you for that.
Another question over here?
Well, it's more of a comment than it is a question. As a healthcare provider and somebody who educates healthcare providers, I think that what you said is right. Healthcare providers, professional people, do not have a problem. We know what we're doing and we're acting in a professional manner, then no one has a problem with that, usually. If they do, I would definitely have questions. But I think it's more an issue of reassuring people and the family who may not be there, who may be feeling guilty, who may be going through a lot of emotional things, and it's a part of the process for them in terms of dealing with it, I think, more than anything else. But I also wanted to make a comment about, this is going to sound strange, soap operas. I think one of the things that with Alzheimer's, dementia, where people deal with is public awareness and making the public aware. Do any of you occasionally watch General Hospital? You don't? Okay. So the crime boss, Sonny Corinthos, father has now been diagnosed with Alzheimer's. And while I've had my issues with soap operas before on General Hospital, not doing things that nurses do correctly, you know, sometimes I have my hesitation. But what it focuses on is the emotional turmoil it causes in a family when the diagnosis is first received, for the patient, for the family, and the crisis that it creates. And I think that it is bringing public awareness, although in a strange venue, to a lot of people, that this is a real problem. It creates a crisis for everyone. So you should watch General Hospital. They do have it on demand.
I do want to make a comment, and she brings up a good point, is that I like NCIS, I watch those, all of the New York, San Francisco, you know, all the different cities that they have it in, and you're absolutely right. Alzheimer's, you never heard about it before, but you're hearing more and more about it. A lot of these shows are incorporated in their shows or in their storylines because they're trying to also raise awareness and let the community know that they're aware that there's a problem that exists. And how better to get it across than, what's the other one, Chicago Fire, I think, also had a recent show that included someone with Alzheimer's. It's a way of life. We're at a stage with Alzheimer's that we used to be with HIV and AIDS.
Okay, we have another question over there.
I had a question going back to Ms. Bruni's comment about, her very personal decision about whether it'd be, better to place her mom maybe in a facility rather than keeping her at home because it's causing a lot of stress. And I think in what I get from her is it's more stressful for her mom. You feel like your mom is getting worse, and yes, of course it's causing stress for you, but you worry more about your mom's mental and physical and emotional well-being, and that's why you feel maybe she's going to be better off in a facility with that. And my thing is, unfortunately here in Laredo, we are very lacking when it comes to facilities where we can place our family members that are, have already been diagnosed with dementia of the Alzheimer's type. We don't have really a lot of avenues to turn to. We are forced to have to go out of town. And there is a local nursing home that recently opened up an Alzheimer's wing, if you may, which I was not very impressed with. And my question to you all is, in this particular wing, I believe it was 40 rooms, and there was like 20 on one side, 20 on the other. It was a long wing, and it was a co-ed, men and women, and there was, on one side it was two, they were sharing the room. It looked more like a hospital setting to me. And in your experience, because I know you all obviously have worked and deal with, Alzheimer's patients, family members, in settings, I'm assuming, medical setting, nursing home setting, assisted living settings. What is your opinion on this particular scenario where you have Alzheimer's patients sharing rooms? And maybe my concern at the time, my thought was, well, what if this patient is at this stage and this one is at this stage, and then the different commotion of two different families in one room? What is your take on that? Your opinion on, is that a good environment for someone that has Alzheimer's?
So the short answer is that it depends on the particular individual, and kind of where they are in the stage and what their particular current cognitive and behavioral symptoms are. You would hope that there would be a selection of individuals and there would be matching, because on the flip side of that, we know that regular social interaction and cognitively challenging activity can also be positive for individuals with dementia. But it's about kind of also, there's a values component too. I mean, if it's co-ed, and particularly before, and there can also be cultural interactions there. There can be a very strong sense of proprietary, or feeling proprietary and not wanting to act a certain way or be a certain way around people. And so I think all of that needs to be taken into account. And if done well, it could work. But then there could also be a situation where there's mismatching, and if that's not taken into account, it can't be even to there. So it really does depend on how that's being managed in the particular institution.
I think on the other end of that spectrum too, there's never an ideal situation because people don't see it as being someone's home. And so that's, for some people, probably in that facility, they're probably Medicaid-funded Alzheimer's unit. For a lot of people who can't afford the private pay of an Alzheimer's memory care center, or even an assisted living facility, and as they progress into a memory care center, that might be the most affordable place. But another thing that a lot of people don't look into for residential care is the residential care homes, the personal care homes. Now, in Texas, if you have 3 or less people in a home, you don't have to be licensed, so you need to be very careful with that situation. So, but there are people there who are doing fabulous jobs caring for people in personal care homes, in what they call elder care homes, and they have, you know, you just have to be like you would be in any facility. Some people are, you know, you put the shiny little keys in front of them, with this new shiny little place and this new nice paintings, and it's a beautiful building, and it's just, it looks like a palace, but the care can be very bad and poor as well. So sometimes I think that a lot of nursing homes get a bad rap, and because of their history, but you know, just like anything else, there's a lot of bad, you know. You go to one Home Depot in one part of town, you go to another Home Depot, and they're completely different, so far as customer service. So, you know, you have to really do your homework and be very, very important. It's very important for you to do your homework. But keep in mind that there's other things that you can look at. So, I know people that had long-term care insurance, and so they have the money to be able to stay home and have someone care for them 24/7. But if you have the financial means, it's important to kind of research that out. And I'm really surprised, I mean, how many memory care centers are there in Laredo?
Zero.
Wow, gosh, no wonder. Gosh, I'm surprised this room isn't full and that room's not full with caregivers that are just stressed out of their minds.
We don't have day centers either.
You don't have an adult daycare either?
We have adult daycare centers, but they don't specialize in.
With dementia and Alzheimer's, they have chronic diseases, chronic illnesses, and they are also developmental disabilities of younger adults.
And then you have,
wow,
and
that's rough.
then unfortunately you have a lot of the home health
Or
facilities.
what then again?
Yeah. A lot of the home health, the businesses that provide home health services, their staff are not trained to deal with people that have Alzheimer's. So I know when we dealt with my dad, and my dad died in 2008, 10 years ago. And to this day, I still hear stories where, oh, me mandaron a palomita, and doesn't know anything about Alzheimer's. So we were having to train their provider. Instead of the provider being already trained from the facility, and there were some of them were CNAs, and we still were not versed on Alzheimer's. So it's just really hard. It's really hard.
I didn't know you didn't have any. What's the closest town that has a memory care center? In San Antonio?
That way up in the valley.
And you know how hard it is for us to release a family member 100 miles down the road from us anyway, whether it's children or anything, you know, it's just, it's very difficult for that separation to occur. Wow, I didn't think that's a significant issue.
All right, folks, we got a few more minutes so that we can stay within our time frame and our agenda. So we've got time for just a couple more questions. So if you have any more questions, let's please address them at this time. No? All right, once again, a big round of applause for our panel. Fantastic job. We are going to resume with our programming. I'm sorry? Oh, okay, yeah. We do have so panel, if you want to go ahead and come over here. I think we're going to have Cacie, you can talk about something right now? Okay, yeah, go ahead.
And then we can break, right?
Yes. Okay.
Hi, my name is Cacie Waters. I work with the association as a public policy specialist. I know that Jenny and Dr. Kutac did a great job of prefacing some of the advocacy and public policy roles of the association. I just wanted to let y'all know that I work very closely with our elected officials on the state, federal, and even local level. And we currently have a piece of legislation that's called the VOLD Act, which stands for Building Our Largest Dementia Infrastructure for Alzheimer's Act. And it really focuses on establishing centers of excellence for Alzheimer's care at the local level. It wants to collect data and analyze that data so that we can have numbers to give to our elected officials. They really care about that information when we're asking for their support. And it also, I think the strongest component is that it addresses Alzheimer's as a public health issue. I mean, you have 5.7 million people living with this disease. It's the most expensive disease. It's the sixth leading cause of death, fifth leading cause of death in Texas if you're African American. And it's the most expensive, but it doesn't, not only is it lacking in cure, there's no treatment. As our doctors discussed earlier, the medicines on the market only treat the symptoms. does nothing to slow the progression or prevent it. So we're really asking our federal officials to help us better treat this disease, manage this disease, and find a cure. So Joe Arciniega is our ambassador to Congressman Cuellar. I know that he has a lot of support in this community. He's very loved. And we are asking him to support this piece of legislation. He isn't a co-sponsor at this moment. And we have a sign-on letter, and if you briefly read the description of the bill, if you have any questions, please ask me. But if you sign the letter, we deliver it to him in DC when we go in June this year. We go June 17th through the 19th. And I can take a lot of signatures to his office and say, these people in your district, in your zip code, on your street care about this, and they're asking for you to support our bill, and we need your help. As Dr. Kutac mentioned earlier, the federal government, in addition to NIH and the Chinese government, is the largest funder, or excuse me, the association is the largest funder of research, and that's because we get support from our government, and we need their continued support, and we need more. So if y'all have any questions about this legislation, please ask me. We will pass it around, y'all can read a little bit more about it, but I think it's great that it's addressing it as a public health concern, because it's not normal aging, it's not an aging disease, it's not, you get this when you're older, like there's younger onset, there's a lot of people living with this, so it's a good way for y'all to ask y'all's federal members for help.
I've got a question.
Yes, ma'am.
The question is this: one of the things that helps move the legislation is talking. Oh, thank you.
One thing that helps move legislation is two things. Knowing something about the incidents in the particular community and how large a problem it is in the particular community. And then having some personal stories, because numbers just don't really tend to grab the people you need to grab to get the money. So how are you getting, one, the data related to the incidents in our community? And is it self-report? Is it family reporting? Is it physicians reporting? Is somebody doing cognitive tests and, with their health fears when they're screening out there? And who is doing this in terms of the quantitative data and then the personal stories in terms of the lived experience? Who's doing that? Joe?
Well, Cacie, we were just talking about that, so Cacie, I'll let you answer that question, and then I just want to piggyback on that.
Yeah, sure. So I definitely understand the numbers don't pull them, it's the stories, but it's getting those volunteers that want to make those visits to federal members of Congress to share their stories, to go to the district offices, to go to DC with us. And the numbers, we have them, but they're underreported. And this bill that I'm speaking of specifically wants to put in place a means to collect and analyze that data. We can't really report on incidents and how it impacts one part of the community when we don't have the systems to collect and analyze that data. This bill is focused on building a dementia infrastructure to collect those numbers and analyze it further. So it is a federal piece of legislation, but it's authorized through the Centers for Disease Control, and it would make these systems local so that we would have the numbers for our state senators, representatives, our Secretary of State, our federal members of Congress.
So right now, it's just building the infrastructure to get the
Yes, ma'am, because
That's right.
currently there is no universal structure to collect that data.
That's part of what this is going to accomplish. So if I could just say just a very few words about this. We're actually in Laredo. So District 28, which I am now officially an ambassador for, Henry's district is outside of Laredo, as we know. But as we now are clearly, and in some ways shockingly, being made aware that Laredo is way behind on the resources that we need even to just deal with the on-the-ground challenges that are happening to families here. And this is where Laredoans are going to be the ones that are going to have to make a difference. So when they asked me to be an ambassador and I started having conversations with Cacie, and it was all on the telephone, I was just blown away by her knowledge and her passion and her detail and her connections and everything else. So of course when I finally went to San Antonio to meet her, and I'm sorry, she just is so young and so tiny, and I just thought, holy cow! But believe me, don't let the appearance fool you. She is a powerhouse and has a great opportunity to help us. And so with us working together, and we're starting to develop some additional team members here in Laredo. So this is the appeal I would make. One, everyone here for sure should sign this. This will literally, essentially tell Henry, Congressman Cuellar, that we need these very basic attentions here in Laredo. And he's from Laredo, and many of us grew up with him, and he knows Laredo is who keeps putting him in office. So this is something, we are in pain, we're hurting, and we're feeling the impact of this. We want him to know that those of us in Laredo want to build this infrastructure, and it's going to take legislative action to build it. We want him to know, of course, that there's research funding that we need, and that's huge, that's just giant. But he is a very important person on the Appropriations Committee. I mean, you know, he is. So he is a person that anyone in this country that's interested in this would want to influence. So we, of all people in Laredo, should be doing that influence. So the first step we can take here is to sign this petition and sign many of them. You know, get many of the signatures on here, because I know he'll see it. That's one. Second place is, please, we are appealing for people to help us here on the ground. As a named ambassador, I have the principal responsibility to make sure that stuff's happening, but I, by a long shot, cannot make that stuff happen alone. So I've already approached a couple of people and asked, and I said, listen, I get we're all busy, but maybe we'll say, we need you to just issue a letter here, or write this to the Laredo Times, or can you just please make a couple of phone calls and let's get this going. Any of you who have what it takes, and I know many of you do, please offer yourself as a volunteer. I promise I won't be burdensome. I won't ask you to do stuff that you really don't want to do. But I'd like to get as many people in Laredo that say, I'm in the Army. Count me in. You tell me what I need to do. And we will be most grateful for that. So first of all, thank you, Cacie and the Alzheimer's Association. These people are awesome. But San Antonio, just to be blunt, has a lot more resources than we do. And it's Laredo that we need the attention, and we don't have an office here. They are officing in San Antonio, and we're part of their area. But we can make some stuff happen here in Laredo. You know, we always do it our own way here anyway. So, so please sign this. You tell me where you want me to pass it. Okay, you want to pass it? Please sign this before you leave today. Thank you, everybody. Appreciate it.
Let me also mention,
Thank you, Joe. Dr. Lozano has a comment.
You get that, Roy? I do things the wrong way here.
Talking about grassroots efforts, sometimes, you know, when you live inside this little box, sometimes the reason you don't have anything is because you're still living inside that little box. And it's important to kind of reach outside of that. But also, look at your local medical professionals, the hospitals. They can maybe help start an adult daycare center. You know, I know you've probably already gone that route. If you want to I'll tell you a story about that, about me in Laredo that happened about 20 years ago. Why there's no Jerry Psych unit here, but
That's a little story, right?
Anyway.
They invite them to come and they don't.
Yeah.
That's that.
anyway, never mind. If they all answer my question right here, this little circle.
That's a very vocal circle, and according to my Laredo watch, we're going to take a quick break. I want everybody to please stick around. I want you to hear Dr. Lozano. She's an amazing presenter, and she's got some very insightful information about caregiving that she wants to share with you. So please come back about 1:58. Please do not leave, okay? Thank you. Oh, and when you come back, maybe before we get her started, I might give away a couple more of these gifts that we have here. So you guys might want to make sure you come back.